Second of our patients that bring their perspectives is William Murray. Bill is a self-employed plumber for his own company, Shamrock Plumbing, until chronic kidney disease and end-stage renal disease forced him to retire. He is an active fundraiser and national advocate for the National Kidney Foundation Kidney Walks in Wilmington, Delaware, NephroCure Kidney International, IgA Nephropathy Foundation of America, and the Gift of Life program.
My name's Bill Murray. No jokes, no Caddyshack jokes, no jokes of any kind, please. Let's start with my story. My story actually goes back to when I was 18 years old. I've been on blood pressure medicine since I was 18 years old. I think my primary care doctors should have done a better care and kept checking a few things. But I was basically given blood pressure medicine and told, come back every year. Forever. And it seemed like it was forever. Then one night when I was 36, back in 96, I was dealing cards at a church benefit. Went to the bathroom. Didn't like the sight because it was all red. I said, I'll see you guys, I'm leaving. I'm heading to the emergency room. About 3 months later, I get a shot with a gun in the back for a biopsy of my kidney. And I was biopsy proven to have IgA nephropathy. It's a nephrotic syndrome. And from that day, I talked with my nephrologist, who isn't here, who has since retired. I gave him gray hairs too, Dr. Polnareau. He's now in administration at St. Francis. He gave me 5 years until I'd be on dialysis. He said, well, we can do a little bit with medicine. You can change your lifestyle and your diet. Changed my diet, went on the DASH diet, took all the medicine, ACE inhibitors and everything else. At that point in time, nephrotic syndromes were not being treated with steroids. So I did not end up going through the steroid treatment that a lot of people with nephrotic syndromes go through today. But I was basically through ACE inhibitors and diet and a few other drugs. They controlled it. I made it 16 years. I started dialysis. I started out doing, well, let me tell you this part of the story. At that point, when somebody tells you you're going to have to start dialysis, it scares the living jeebers out of you. And from that day forward, I was not going to let my disease dictate me. I was going to dictate how I was going to handle it. So at that point in time, I researched everything. I knew what dialysis was. I knew all the methods there were. And I knew what I was going to do. So when I had to sit down with Dr. Zudnik, and he said, you got to start dialysis. I said, okay, we're going to do peritoneal. Now, that lasted for about 9 months with me. It didn't work that well. I was one of the patients that peritoneal dialysis didn't work. I was constantly going to the high percentage of sugar solution. I am, since being diagnosed with IgA, I have been diagnosed diabetic. So I was constantly going to the higher concentration of dialysis solutions. And then I started hearing from the doctors and my nurses that your peritoneum is not going to last. I said, oh yeah, just what I want to do is do more damage. I said, okay, let's put the fistula in. So I'm running, getting the fistula, and I'm ready to start dialysis, and I'm going to start home hemodialysis. You walk into a room and they give you a needle the size of pencil lead and say, yes, stick this in you. Joanne will tell you, I told her no way in hell. I says, you guys are going to have to come over to my house every morning and put it in. Well, it took me 3 tries. Now every morning, 6 days, 5 to 6 days a week, 4:30, 5 o'clock in the morning, I'm sticking 2 16-gauge needles in my forearm and strapping myself in a chair, watching ESPN for 4 hours. It's not the best thing in the world, but it's a life. I do get to move around. I do get to set my schedule. Thank you. I took today off for you people. You can survive. You can live. It is not the best way, but there are options. You can make the disease work for you. You are not stringent and dictated by the disease on which way you go. And it's something that, God bless you, it's something that all prescribers, both primary care and nephrologist, has to convey to the patients, that the patient needs to become their own advocate. We have to become our own advocates for everything we do. We have to know all our numbers, like it was mentioned earlier. We have to know what our prescriptions are. We have to know what they're for, why we take them. And I do want to bring up a couple of things that are side notes to the whole process. In the last year, there's been a program at the University of Delaware that wasn't asked to bring this up, but I started participating in an exercise program designed for chronic kidney disease patients. Dr. Kirkman, Dr. Hoffman are here. It is an exercise-based program for chronic kidney disease patients and end-stage renal disease patients that actually gets your, for lack of better terms, gets your ass out of the chair and moving. And it's a very good program, and I think they've got outstanding results that I know they'll be glad to share with anybody. So if anybody needs any backup on what getting up out of the chair and moving can do for a chronic kidney disease patient, they've got the information. It is highly beneficial, just like getting up and walking around the block every day. And I want to close on one note, and this is from my research and what I've learned, that living donors are down in the lowest numbers they've been since 1990. The trend has been down since 1999 for living donors. Dr. Swanson's giving me that eyebrow, so it mustn't be for Delaware. But this is national. And we're not exactly sure why. A lot of people attribute it to social and economic conditions. But there's legislation out in Congress right now that I was very happy that we got Senator Coons to co-sponsor for a Living Donor Protection Act. It's one step. It's a small step. It's a national step. But it'll protect living donors from insurance discrimination and job discrimination, job security. So I urge everybody, if you live in Delaware or where you live, to make sure you contact your national representatives and tell them to get behind it and sponsor it. Because the only way this Congress moves a damn thing is if you yell loud enough and you have enough voices yelling. So I got a contained room right now, so I'm asking everybody to make that phone call. Thank you.